Do. All right, I think we're live. What is going on, you beautiful people? Happy Wednesday. What's up, Liz? Yeah, it's Wednesday. It's hump day. We are like halfway through the week. I don't know why I'm so exhausted this week. Maybe because I was like in Toronto last week for business or something, but I've been sleeping great and I don't even know. So Butters, what's going on? All the way from Ontario. Hey, I was there last week. Kind of somewhat, maybe a little bit exciting. But we're back in the good old Calgary. I thought it was Tuesday, but it also feels like Thursday, not Wednesday at all. I wouldn't say it feels like a Thursday. Actually, no, at one point I thought it was a Friday here. Yeah, I don't know. Very confused with my days and stuff. Yeah, I don't know, feel a little bit out of it. Anyways, Butters, I finally got approved for Contrave and just on it for a week now. Awesome. That is good to hear. Glad you got it sorted and figured out. Well, for everybody else, we're going to have kind of like a quick chat on pancreatitis, pancreatic cancer. It's like one of the probably top 5 questions that I get asked about. So I always look into, the evidence surrounding it, what it all means, and try to decipher it and break it down for you beautiful people. And so, yeah, we're going to have a quick little intro on it, and then we will, take some of the questions from the audience and take her from there. So pancreatitis, I guess we should really talk about what it even is. So the pancreas, little organ in your body, obviously, kind of sits behind the stomach. It looks like an upside down Nike symbol almost, but basically it has a whole pile of different functions, including releasing hormones, digestive enzymes, like a whole slew of things that it does. And one of the things that it does in particular is it releases insulin. Insulin brings our blood sugar levels down. So after we eat a meal, insulin gets released, brings the blood sugar levels down. Everything comes under control and we're all hunky-dory. The other big one that it releases is called glucagon. And glucagon is what's used to increase your blood sugar levels. So it works in concert, when blood sugar or when there's a lack of food in the system, glucagon levels go up, tell the body to produce more sugar so we can keep living. All very well controlled and all that kind of stuff. So pancreas, very important organ, does a lot of things. And pancreatitis, what essentially that means, itis means inflammation essentially. So pancreatitis means inflammation of the pancreas. Now, we don't necessarily know all the modalities and exactly how the inflammation occurs and such like that, but there's a number of things that can ultimately contribute to it and cause it. One of the big ones is going to be things like alcohol use. So if you're consuming a lot of alcohol, that's going to kind of piss off your pancreas a bit. If you are have really high triglycerides, so one of your cholesterol markers, that's going to piss off your pancreas, as well as having conditions like diabetes and some other chronic diseases can potentially cause and lead to pancreatitis. Now, on the flip side, the other thing a lot of people will ask about is pancreatic cancer. Now, obviously, pancreatic cancer, it's not just an inflammation. Pancreatic cancer, very difficult cancer to treat depending on the type of pancreatic cancer. There are different types and such like that, but very hard to mitigate and treat. And does pancreatitis lead to pancreatic cancer? The general, if you have just one episode of pancreatitis, no, you're not going to cause enough inflammation to then trigger and lead to pancreatic cancer. Pancreatic cancer that develops from pancreatitis is going to take kind of multiple onslaughts of the pancreas, so continually inflaming it, continually pissing it off, that eventually you get a change in the genetic code, and and then you develop the pancreatic cancer potentially. as well. There's a whole plethora of like genetic factors and things like that that ultimately can contribute and lead to it. But the big question for today is, do drugs like Wegovy, Ozempic, Saxenda, all the GLP-1 medications, do they cause pancreatitis or pancreatic cancer? And the short answer is, if they do, well, they don't cause pancreatic cancer. I would argue that there's no evidence to say that it leads to pancreatic cancer. Pancreatitis, maybe, but very, very rarely it might cause pancreatitis. The problem is because when we look at a condition like pancreatitis and we look at these kinds of medications, we have a couple of confounding variables. So generally individuals that are taking these medications will also have diabetes. Diabetes, we know, increases your risk of pancreatitis. So is it the medication that you just happen to be concurrently taking that led to the pancreatitis, or was it the diabetes that ultimately led to the pancreatitis? So that's kind of one confounder, and certainly we haven't really seen it tease out too much in the evidence, if you will. The other factor is that other people who are taking this might have metabolic syndrome. One of the components of metabolic syndrome might be elevated triglycerides and lipids. Again, elevated triglycerides can lead to pancreatitis as well. So is it the drug, or is it the triglycerides? Is it some other confounding factor? Do we need to be thinking about it and worried about it? So lots of confounding variables in terms of the evidence. Even if the evidence sometimes does show that maybe there is a slight risk, it's like less than 1%. So very, very rare that individuals that are on these medications will develop a pancreatitis. The other one that can sometimes lead to it is that these meds can lead to very rapid weight loss. And when we get very rapid weight loss, what can ultimately develop is gallstones. And the reason for that is that as you're losing a lot of fat, that releases a lot of cholesterol. Cholesterol is a form of fat, essentially. And cholesterol will collect in your gallbladder in order to go out into the GI tract, either some of it to be reabsorbed and taken back up, and some of it to go out with your bowel movement. But if we get enough of it concentrated in the gallbladder, that's how we ultimately develop gallstones. So if you get gallstones irritate the gallbladder, pisses everything off. And again, the neighbor, the pancreas, gets cranky and upset. And ultimately, it's a gallstone-induced inflammation that then drives the pancreatitis. So again, not directly because of the drug, but more directly because of the rapid weight loss that led to the gallstones and then led to the pancreatitis. So that's kind of some of the things and confounders that we need to look at and be mindful of. Overall, like I said, very real or very minimal risk if it directly causes it, which there might certainly be a case where, the GLP-1 medications like Ozempic and Wegovy, what they do is they improve the efficiency of the pancreas. And maybe in some cases it gets a little, overzealous, if you will, and kind of starts pumping out more insulin than it should, or starts pumping out more glucagon or what have you, and ultimately maybe irritates things. But in general, these medications are actually quite good for the pancreas and can help to maintain some of the cell mass, like our cells that produce insulin, and may even help to proliferate or help to grow new cells, because our cells that produce insulin are constantly dropping as we age. So that's kind of one of the ways that it helps to manage blood sugars, and can certainly help to mitigate and manage our weight and everything like that. So that's kind of the gist of it. Very, very minimal risk, if any. It's probably going to be another confounding factor that's going to be involved there. Now, if you do develop pancreatitis when you're on these medications, the other big question is, can you ultimately come off the medication, or can you go back on it if whatever? And so it really depends. It would be a case-by-case situation. If you say have a pancreatitis and you're using a considerable amount of alcohol and it's determined that the pancreatitis was due to alcohol, then if you stop the alcohol consumption, you might be able to go onto the medication and everything might correct and be hunky-dory and not a problem for you. If it was like maybe your triglycerides or some other factor that we determined that it was this factor that ultimately led to the pancreatitis, then you could potentially go back on it. It's going to be a discussion with your specialist and doctor and stuff like that to decide what's the best option for you. but not out of the realm of possibilities, and certainly something that could be looked at. So, all right, that's that, and a lot of great questions really coming in here. So let's kind of go over them. So Paulina on YouTube, so pancreatitis and what if you no longer have your gallbladder? So good question. I mean, if you don't have your gallbladder, you don't won't have like your bile storage essentially. And so you won't develop gallstones or anything in that respective aspect. And so losing weight rapidly and such like that, you don't have to necessarily worry about that concern or that issue unless there's some other kind of problem with like the bile duct itself. So the duct that goes from your liver to your intestine and that sort of thing, unless there's some other kind of pathology or issue going on there, shouldn't really be an issue. And certainly you can still use the GLP-1 medications. Back up to the top. In a comment. Leslie, I had a Roux-en-Y 22 years ago. Big mistake. Sorry to hear that, Leslie. Why? Oh no. Why? Cheryl, hey, I watch you on YouTube. Very cute. Ugh. Very cool to see you out here. Thanks, Cheryl. I appreciate it. Wendy, thank you for explaining this. Leslie, a lot of side effects due to the Roux-en-Y. Fair enough. Can be one of the downsides of that surgery, depending person to person. Christina on YouTube. What if you're someone like me who doesn't have a gallbladder? I had mine removed when I was 17. Okay, so I think I kind of already answered that. But yeah, you don't have that risk of gallstone development. I mean, depending on why you had the gallbladder removed in the first place, it may have been gallstones that causing inflammation and that sort of thing. But rapid weight loss shouldn't be an issue, shouldn't be a concern in the development of gallstones, unless again, there's some kind of pathology in the bile duct itself that could certainly lead to some problems and complications. Maddie B, I'm on Victoza. Jody, is the inflammation worse for the pancreas if there is no gallbladder? So if there is no gallbladder, the inflammation wouldn't be worse for the pancreas. I mean, there's still separate organs, separate entities and stuff like that. And if you don't have the gallbladder, you don't develop the gallstones. That doesn't ultimately cause the inflammation that can piss off the pancreas and such like that. So shouldn't be an issue, shouldn't be a concern. You can certainly take these medications if you don't have a gallbladder. And if anything, maybe your risk of pancreatitis would actually be lower. I don't have any studies to verify that or to say that, but in theory, if you don't have the gallbladder, potentially. D, what's the difference between Ozempic and Mounjaro? So difference between Ozempic and just for everybody out there, Ozempic is Wegovy, and it's also the molecule that is found within Ribosis as well, the oral tablets. The generic or not trade name, but the generic name of it is semaglutide. So comparing semaglutide to Mounjaro or tirzepatide, they both contain the GLP-1 hormone or molecule, so that binds to the GLP-1 receptors, exert the effects in terms of reducing our appetite, helping with blood sugars and that sort of thing. And then the difference with Mounjaro, though, is that Mounjaro has an extra component called GIP, which is a glucose-dependent insulinotropic polypeptide or protein or something like that. Some extra component. And the best way to kind of think about it is that it kind of synergizes with the GLP-1 molecule and binds to the GIP receptors that it binds to, and kind of potentiates or makes the effects of the GLP-1 more prominent and more significant. So it creates overall better results in terms of managing blood sugars and managing weight with that extra component. And so, yeah, it kind of seems to help in that regard. So that's kind of the difference there. Yeah, that's going to be kind of what we're going to start seeing come to market nowadays is a lot of combination medications. So like GLP-1 with other hormones and molecules that we know are involved in satiety and that sort of thing. So yeah, that's kind of the difference there. Linda, I'm on my 3rd month of Wegovy at 0.25 dosage. It is still working. I'm losing about 10 pounds a month. Is there a problem staying at 0.25? No, in general, if it's working for you, whatever dose you're at, you don't need to go up in dose. I mean, we always like to push the dose in certain cases and situations because we may get more effect or more weight loss and stuff like that. But it's certainly not mandatory. If there's a dose that's working for you and it's working well, and you're not having side effects, then no, you don't have to go up in the dose by any means. So yeah, you can continue trekking along like that, no problem. What are the symptoms of pancreatitis? Good question. So the symptoms of pancreatitis is very significant abdominal pain. Like generally that's the main complaint that people have. They end up in the hospital. And basically all we can give them is painkillers like morphine and that sort of thing in order to help manage the pain because it is quite severe. Short of that, it's going to be things like nausea, vomiting, maybe diarrhea, other GI issues and problems like in that sense. And then the abdominal pain. That's kind of the main set of symptoms that we generally see. Not always easy to kind of pick out, but certainly based on the pain level, you'll know something is definitely not right. So yeah, other than that, blood tests that can be done. We could look at your lipase level, which kind of indicates that maybe there's some inflammation going on in the pancreas as well. Lipase is kind of one of these markers that can be elevated, but does it mean anything? Not all the time. So a lot of different things that would need to be taken into account, and we'd have to correlate the value of a high lipase level with what kind of symptoms you're presenting with and how we manage it and stuff. Tilted tables. What causes the sulfur, burps, and gas? It's so gross. So the big thing that's causing the sulfur, burps, and gas is these medications, the GLP-1 medications, slow down how quickly food goes from your stomach to your small intestine. And so what's happening in that respect of things is that when things aren't going down as quickly, well, the only place they're going to go is back up. And so especially if you overeat or anything like that, it's going to come back up. It's going to be kind of the sulfur burps because it's also bringing things like acid up. So you're getting a bit of acid reflux and that sort of thing. And so that's primarily what's driving that aspect. It's just stuff's not moving down as quickly anymore. And so the only place it's going to go is back up. And yeah, one of the unfortunate side effects for sure. Christina on YouTube, I stopped Ozempic after 6 weeks because I couldn't handle the side effects. I gained my weight back plus an additional 10 pounds. What causes that? So Christina had to come off it, couldn't handle the side effects, gained the weight back plus an additional 10 pounds. What causes that? So there's a couple of things that lead to this overshooting in terms of weight regain. Number one, when you lose weight or when you lose weight or in a calorie deficit, your body metabolically adapts and reduces your metabolic rate, not only by getting you to move less, but also your general rate of how much calories your body burns by simply existing and stuff like that. So first off, we have that. So you've metabolically adapted, lost some weight, awesome, cool, what have you. But when you start to come off the medication that's been helping you eat less and suddenly you start eating more, well, suddenly your body is going to be much lower metabolically rate-wise. And so you're going to be consuming calories that are going to be more efficiently taken up, absorbed, and more easily put into fat storage because your body doesn't want to lose weight. It's basically priming you to regain weight anytime you try and lose weight or in a calorie deficit. It's always kind of going into that, thinking the evolutionary aspect that food is not around anymore. The other big thing that happens is that what we maybe not in a maybe a 6-week period, it all kind of depends. So every single human out there, we're essentially all born with roughly the same amount of fat cells. And so our fat cells are a certain size, and at that size, they are at releasing a hormone called leptin. Leptin is kind of like a thermostat. It kind of sets our set point of our body's weight, if you will. And so when leptin levels are at a certain level, everybody's happy. The body is saying, okay, we want to stay at this given weight. It's pretty easy to stay there. You don't really have to think about it too much. And your body just kind of hovers and hangs out because your leptin level, enough of it is being released from your fat cells, going to your brain and kind of telling everything to stay in balance and that sort of thing. So what happens when you lose weight is your fat cells get smaller, and therefore they release less leptin out there, then triggers and sends a signal to your brain saying, hey, we don't have as much leptin, we're losing energy. So we need to get this person to eat more food in order to make up for the lost energy, because we need to bring it back up to the set point. The second thing, we need to slow down the metabolic rate and become more metabolically efficient or fuel efficient. So what food you do put in gets used much more efficiently and that sort of thing, until we can maybe get the fat cells back up to a certain size that we want to reduce or release enough leptin in order to shut off the appetite, bring metabolic rate back up, and that sort of thing. However, there's some evidence to show that if you've lost weight, your fat cells have shrunk. And like I said, everyone has the same amount of fat cells in their body, pretty much from birth until death. But if you lose a bunch of weight and then in the post-diet period, you consume a large amount of calories and gain a large amount of weight very quickly, what we think might happen is that your body might actually start splitting your fat cells, so creating more fat cells versus just keeping it at a static number because you're gaining weight so rapidly. And so what's going to happen here is now you've got more fat cells, and so you reach your previous diet weight, and your fat cells are all going to be smaller because there's more fat cells. There's the same amount of fat mass, but the fat is spread over a greater number of cells. So your fat cells are going to be smaller, and overall you're going to be releasing less leptin. That's not going to shut down the appetite function in the brain. So your brain's going to keep getting that signal, even though you've reached your pre-diet weight, keep getting the signal, not enough energy, need to eat more, keep the body metabolically adapted. And until you gain more fat mass and the cells all finally, the larger number of cells swell back up to the size that they need to be and release the appropriate amount of leptin, then that system will shut off and that sort of thing. So that's kind of what can happen is in the overshooting process is basically you can sometimes, if it happens quite rapidly, develop more fat cells, which then affects your leptin levels, which then causes this overshoot in trying to get you back or to a new set point that the body prefers. So it's kind of a convoluted answer. Hopefully that made sense. But yeah, good question. Karen, is Wegovy available in Canada? Ozempic is. I haven't heard. Wegovy should be like any time now. But as far as I know, it's not quite here in Canada yet. It's approved and stuff, but not quite here. After having Wegovy-induced pancreatitis, how long does it take to resolve? I mean, pancreatitis really depends person to person. Could be a couple of days, could be a week. Really, really tough to say how long exactly it takes to kind of resolve and get everything to calm down. Obviously, you need to remove the insulting thing. So if it's the Wegovy that's causing it, it needs to be discontinued, and Wegovy can take a long time to clear the system. But nonetheless, once you stop taking it, the levels are going to start reducing and hopefully get things a bit better controlled on for you. Maddie B, I need help. I do qualify for sequence help. I would talk to sequence in that case. Amber, how can I get Ozempic covered in Ontario? So as far as I know, the biggest thing of getting Ozempic covered in Ontario, probably pretty similar to here in Alberta. Yeah, you're going to have diabetes is generally the criteria around it. As far as I know, the provincial programs haven't changed or anything. Might be a bit different with some private payers. But yeah, that's kind of the gist, is that you need to have diabetes. Okay. Okay. Grandma Jenny, do you think Wegovy will cause cancer? I get scared of that. So there's no evidence that Wegovy causes cancer or anything in that respect. The thyroid cancer that everybody talks about, we've only seen it in animals. We actually haven't seen it in humans at all yet. And like I was saying earlier, pancreatic cancer, very unlikely that's going to occur at all. Do you think maintenance dose is healthy to do? Yeah, I mean, we have like 20 plus years with these drugs, so no concerns at present, for sure. Does Ozempic affect menstrual cycles? So I recall reading something on this. How much it affects menstrual cycles is tough to say, and whether it's the Ozempic itself. I mean, if you have PCOS, for sure, it can certainly help to correct some of the, what you would call it, like insulin resistance and that sort of thing, which then can affect your menstrual cycle and make it more regular for you. So in that sense, yes. There might be something with regards to losing weight and estrogen levels and fats and everything like that, that could potentially cause some issues with like spotting and that sort of thing. So yeah, it definitely could, especially if you have PCOS. Andrea, I've been on Ozempic for years, plateaued at 162 pounds for over a year, up to 1.5, 3 months, and no change. Any suggestions? Same thing I always recommend. Take a diet break, chill out, like figure out what your predicted maintenance level of calories are or should be at your age, height, and weight. Increase your calories up to that point, and then hang out there for a few months. Focus on weightlifting, weight training, build some muscle, and yeah, and then you can look at creating a calorie deficit there afterwards. Yeah, that's kind of my biggest suggestion, especially if it's been a long time for you and you're looking to lose more weight. Certainly need to kind of change things up and generally take a break to kind of help with the metabolic adaptations and that sort of thing. So keep that in mind. If you need a calculator to figure out what your maintenance level or predicted maintenance level of calories is, you can check on my website, healthevolved.co. Again, that's healthevolved.co/TDE-calculator. It's also on the main page. If you look into resources and stuff, you can punch in all your info there and select optimal health, and it'll tell you what your maintenance level of calories should be. So yeah, that's kind of that. Chloe, where are you from? I am in Calgary, Alberta, Canada. UT Rob, I've lost 60 pounds in 7 months on semaglutide and the weight loss has slowed down. So my doctor added Contrave to help me lose my last 20. Have you heard of people combining weight loss meds? So yeah, it's becoming more and more in practice of people combining weight loss meds. I'm not a huge fan of it. Very rarely would I recommend it. The reason being is that if you're on one weight management medication and you've lost weight to a certain point and the weight is stalled out, fundamentally, we're no longer in a calorie deficit. And so we need to really look at, well, why aren't we in a calorie deficit? Is it because, you know, we're just still way overeating and still having appetite issues and stuff like that? Then yeah, maybe adding something else on might be worthwhile. If it's that, you're restricting severely through the week and then having rebound binges or rebound overeating periods and that sort of thing. Is it that we've lost a significant amount of muscle mass and we need to get into the gym or just use some bands and weights at home and start resistance training? Is it our diet? Like, there's a lot of things that need to be taken into account before we just add something else on. It's not necessarily wrong or anything like that. But if you're not losing weight, what it means is you're no longer in a calorie deficit. If you're no longer in a calorie deficit and you're not able to get into a further deficit, well, I can throw drugs at you all day long. But if you can't get into that deficit and consistently maintain it, eventually biology is going to bite back and it's going to get you to overeat and overconsume. So it can be done. I generally like to look at a lot of other factors and tee those things up. Everything from, like I said, nutrition, resistance training, sleep, stress levels, all those things are ultimately going to have a role in your weight loss and stuff like that. And so looking at those factors and making those other changes and considerations and stuff. So hope that helps. So Carla, I've worked up to 1 milligram for a month now, no nausea, no weight loss, but sugars are perfect. Should I go up in dose? Ultimately it'd be between you and your doctor, maybe. Again, if you've lost no weight, you're not in a calorie deficit. So looking at your dietary patterns, especially if you're getting appetite reduction and stuff like that, seeing where you're currently at in that regard. If you're not getting appetite reduction, maybe going up in dose can help. But you need to look at all the other factors before kind of making that call. How can I get Ozempic covered in Ontario if pre-diabetic? Is it covered? So possibly it might help with, because pre-diabetic isn't necessarily a true diagnosis per se. You either have diabetes or you don't, kind of thing. So you might be able to, but doctor probably has to fill out some a form or info for you, and kind of go from there. Perfect. UT Rob makes sense. Thank you, Dr. Dan. Jenny of Coldstone, will intermittent fasting work with Wegovy? So any diet plan that you want to ultimately follow, as long as you get into a calorie deficit, will work with these medications. I generally don't recommend intermittent fasting because Wegovy, and in terms of the weight loss and stuff like that can occur with it, there's quite a bit of muscle mass that can be chewed through, and intermittent fasting can ultimately lead to further loss of muscle mass. And muscle mass is vitally important for like literally everything, including keeping your metabolic rate up and stuff. So I generally don't recommend it for a few reasons, plus 99.9% of people can't sustain it long term. I generally don't recommend intermittent fasting. But again, whatever diet you use with these medications, it'll work as long as you're in a calorie deficit. And the medications might make it easier to achieve a calorie deficit more consistently with whatever diet plan or strategy you want to use. Kelly B, what can you tell me about Contrave and side effects? I had to stop after 6 days, so nauseous. So nausea is certainly one of the main side effects that can occur with these medications, at least at the start. It should subside, and that's generally why we start at a low dose. So we start with 1 tablet once a day, then we increase to 1 tablet twice a day, and then 2 tablets in the morning, 1 tablet at night, then 2 tablets twice a day. And generally that helps to mitigate the side effects. Obviously not the case for everybody, but nausea can be one of them, constipation, headaches, increased sweating, palpitations, increased blood pressure, all potential side effects of Contrave. Generally pretty rare, pretty mild. If you do experience them, then should go away after a period of time. Can you help Amberlynn Reed? I have no idea who that is. SJ, do you know if Canada will allow doctors to prescribe 2 milligram Ozempic doses in the future? So doctors can already prescribe the 2 mg Ozempic doses. Technically, Ozempic at a dose of 2 mg once a week has been approved for diabetes management. So doctors can, we just don't have the 2 mg Ozempic pens here in Canada. Healing naturally. I've gained a lot since having pancreatitis due to food intolerances. Safest approach to weight loss. Slow and steady would be the safest approach. I mean, kind of figure out what your predicted maintenance level of calories is, minus about 15% to create a calorie deficit, adding in things like resistance training, getting plenty of activity where you can, managing sleep and stress and that sort of thing. And then, of course, through all of this, working with your food intolerances in order to just find a diet that ultimately works for you. Ultimately, you're probably going to have and eat a lot of the same things over and over again, which if you're okay with that, isn't a big deal or anything, as long as you're eating kind of somewhat a variety of things. And then, yeah, just kind of slow and steady, keep consistent with it is going to be kind of your best bet. I mean, when it comes to weight loss, consistency is like the foundation. If you can't be consistent with it, nothing else matters. So consistency, high protein, well, I guess consistency, calorie deficit, protein, resistance training, and sleep would kind of be included with all of that. So Gina McManus, do these weight loss medications make other meds take longer to take effect? Example, anxiety meds. I mean, anxiety meds, like, I guess it depends on like if you're just starting on anti-anxiety meds, or if you're kind of using, say, a benzodiazepine as an on an as needed basis. These drugs like Ozempic and the GLP-1s can slow down transit time in the GI tract. So it may slow down how quickly a drug is getting absorbed from the GI tract. How much that is, it's tough to say. It shouldn't be really all that significant of a change or anything, but it's going to vary person to person and such like that. So yeah, it really all kind of depends, but the benzos shouldn't be a problem. But other meds, yeah, maybe potentially. Is Mounjaro available in Canada? So it's approved here in Canada for diabetes management, but it is not currently available in Canada. K-shit, opinion on Ribosis. I'm on day 7 today. Ribosis is, I'm not a big fan of Ribosis, to be honest. I mean, it's good, it's effective. If you don't like needles, it can be good to use. Kind of some of my qualms with it is, number one, because of the technology, and because GLP-1 or semaglutide is such a massive molecule, there's a lot that needs to be done in terms of the technology to get it inside of your body, so via the GI tract. And so basically we get this tablet and you can't have any food in your stomach, can only have a little bit of water. In order for the technology to work, to get the drug from your GI tract or your intestine inside of your body. And even then, only like 1% of the drug that's actually in that tablet gets absorbed. Whereas when you inject it into the fat, well, like 90% of the drug gets absorbed. So in the case of Ozempic, a lot more gets into the system, and generally it's much more potent and much more effective in managing weight and helping with weight management and stuff like that. Same thing with blood sugar management. Now, in saying all of that, there's some people who it works just fine for, but overall the results that people get are not anywhere near what we see with like Ozempic, Wegovy, Saxenda, and that sort of thing. So it can work, but yeah, it's not nearly as effective. Yeah, that's kind of the deal on that one, I guess you could say. Casey of the Pips, my daughter asked the doctor for Ozempic, but they gave her phentermine. Yeah, I mean, that's tough to, it kind of all depends on the assessment, the doctor's comfort level, and various things like that. So If the doc felt phentermine was a better option, it's not the end of the world or anything like that. It certainly can help and be effective for weight management. Yeah, it kind of all depends on kind of the conversation and stuff like that went down there, but it still can be an effective agent for sure. So these meds are causing pancreatitis. That's terrible. No, like, no, yeah. Yeah, hi doc. Thanks for all your advice. My pleasure. Hillary G, how long should Ozempic be used? Can be used for a year and then discontinued. Will I gain again? Yeah, 95% of people, I will say, that go on Ozempic, Saxenda, or what have you, will lose weight on it. And if they come off the medication, they're ultimately going to gain the weight back. The only people who've been able to keep the weight off are people who are able to make a full switch in terms of their dietary patterns, their lifestyle, and that sort of thing. That includes weightlifting, optimizing sleep, stress levels are optimized, getting plenty of protein, and kind of looking at maintenance level of calories versus weight loss and that sort of thing. So those are the kind of people that are able to maintain it. But 95% of people, it's just not the case because of either life circumstances or what have you. So these drugs are generally lifelong. Lots of good data to show that when you come off of it, you do definitely gain the weight back for most people. So yeah, that's kind of the deal on that respect of things. So unless you can make the full lifestyle flip and changes and stuff like that, medications are going to be something you need to stay on for long term. Deanna, what do you think of the ball in the stomach? I mean, it certainly wouldn't be my first go-to. There certainly can be complications with it. So basically getting like a balloon in your stomach to take up space and to physically limit how much food you can ultimately fit in your stomach. That's kind of the idea behind it. Yeah, I mean, it can be effective for some people. Certainly people lose weight on it because, yeah, it restricts how much you can eat. Can that be, is it long-term? Maybe. Are there complications? Yeah. Are there better options? Definitely. So I generally am not a fan of it. Corey Danielson, what clinic are you working at in Calgary? No clinic currently. So I have my own coaching consultant service that I provide to people across the globe currently. If you want to work with me, healthevolve.co, you can check out my website, book a consultation with myself there, and we can see if you're a good fit for the program. But in like the next 3 weeks here, I'll be kind of announcing where I might be kind of working out of. It's all kind of on the DL at the moment. But if you want to follow along and find out the more the insights is when things will be changing and get the more immediate updates, definitely follow me on my Instagram at the official Dr. Dan, and some updates will be coming soon. Chloe, are you in Canada? I am. Suzanne, I had pain in my upper abdomen last week, but after injecting in my leg at a higher dose, I feel okay. Okay. Yeah, I mean, it all kind of depends on where you're injecting and that sort of thing. Can make a difference and stuff. What do you think of Ozempic? Sorry, I don't remember the name of the new prescription weight loss medication. So yeah, Ozempic, Wegovy. Wegovy is the weight loss form of Ozempic. Yeah, very effective drug, very effective. Does a great job at helping people to manage their weight and certainly their blood sugars as well. So I've prescribed it a lot, use it a lot with various patients and stuff like that. So definitely an effective agent and certainly a safe one too. Kelly B, thank you. Karen, thanks Dr. Dan for offering us your time and knowledge to teach us about these meds, very helpful. My pleasure. Wendy, these live videos are so helpful. Pleasure. You are very welcome, everybody. Suzanne, is Ozempic okay to take with prometrium? as far as I know, yeah, as far as I recall, there isn't any interaction there. I'd have to double check and definitely double check with your pharmacist, but from what I recall, no, there shouldn't be an issue taking Ozempic and Prometrium together. Tanisha, I have water under my skin. How do I get rid of it? How do I get rid of it? It hurts when I getting blood taken. I mean, it really depends on what's the underlying cause of the water under the skin. I mean, we all have some fluid in our bodies and in our various tissues and stuff like that. So it kind of depends what the underpinning problem or issue is there that I would want to get looked at to figure out what we need to do to get rid of it for you. DWA Consulting on YouTube. So can Trulicity be taken 2 times a week safely if you have missed a dose? So the general rule of thumb with these long-acting guys, so Ozempic, Trulicity, and that sort of thing, if say you were supposed to dose today, Wednesday, or you're supposed to dose here on Wednesday. So Wednesday's your dosing day, and suddenly it's Friday, and you realize that you forgot your Wednesday dose. No problem. You can give your dose on the Friday without an issue, and then continue on with Wednesdays there afterwards. If, however, you fall out of 5-day zone, so Wednesday was supposed to be dosing, Thursday, Friday, Saturday, Sunday, Monday would probably be the last day that you would be able to dose at your regular dose and kind of play catch up. Now you could either choose, if you dose on Monday, to either do Monday as your new dosing day or continue on Wednesday, in which case you could do Monday and then Wednesday. There would be no problem with that or anything like that. You might have a bit more, just some side effects, mild side effects for the short term, but that shouldn't be a problem. But if you're outside of that 5 days, so it's Tuesday and you missed last Wednesday's dose, then you need to decrease to the lower dose. So with Ozempic, if you're on 1 milligram, for example, you'd need to decrease to 5.5 milligrams and do that for a couple of weeks until it builds back up in your system. So 5 days is kind of your time period in there that you can take, and if you miss a dose, take it within the 5-day period. So Brandy, I was denied bariatric surgery as they found I have congenital hepatic fibrosis of the liver. Can I take Ozempic? I mean, Ozempic does get somewhat metabolized through the liver and stuff like that. So it would depend on how severe of fibrosis we're talking, and that sort of thing before we could even make any kind of call in that respect. Brittany, how much weight should someone who's 330 pounds expect to lose on Ozempic? Impossible to say. All kind of depends on dietary patterns, how consistent you are with your diet, what are the changes you make, what's your muscle mass level. Like, there's so many factors that go into it. It's impossible to kind of predict and say you're going to lose X amount of weight. On average, in the studies, people lost 15% of their weight from baseline, or 2/3 of people did. So say if we take 330, so 10% would be 33. So add another, 33, 15 pounds. So yeah, you maybe lose around 33, why can I do this? 48 pounds, 48-ish rough pounds or so, somewhere in there. So maybe 50 pounds is what they found in the studies and stuff like that. But again, it's going to depend on so many other factors and that sort of thing. Lily D, what's the risk to eyes with Ozempic? So that's an interesting aspect that came out in the literature and the data. So the big concern, or the risk with eyes that people are always talking about, is a condition called diabetic retinopathy. And basically it's, you get your retina starts to deteriorate essentially, and you start to lose your vision and whatnot. And so what was found in some of the studies is that people who were on these medications, the GLP-1 like Ozempic, Saxenda, developed this diabetic retinopathy. But what we have found is that it's not actually the medication that's driving the diabetic retinopathy. What's happening is that it's because of the large and quick decrease in blood sugar that ultimately causes the diabetic retinopathy in people who already have early stage diabetic retinopathy. So the medication doesn't cause a diabetic retinopathy. Diabetic retinopathy is being caused by a rapid decrease in your blood sugar levels, so coming into basically normal ranges, and you already had the development of diabetic retinopathy. So it might be very mild, you might not even notice it, might not have been flagged by a clinician yet, but ultimately it's there. Then you go on the drug, drops your blood sugars very quickly, and that further progresses the diabetic retinopathy more quickly and leads to it. We've seen the same thing happen when people go on insulin and get a sharp drop in their blood sugars and that sort of thing. It's just these drugs are so effective at bringing blood sugars under control that it can potentially worsen it. Now, if we were to put you on this drug and slowly reduce the blood sugars more gradually, we can mitigate that risk of the diabetic retinopathy because it's not the quick, sharp drop that what we usually see. So that is that one. Wendy, is there any risk taking HRT and Ozempic? Generally, no, not that I'm aware of, but of course, follow up with your team to confirm. Radiator glow, I have really high blood sugars. I won't go to the doctors. Will taking Ozempic help blood sugars and lose weight? Yeah, it certainly can help with blood sugars, but would highly recommend following up with the doctor, just double check everything and stuff like that and make sure it'd be safe for you to take and there's no other concerns or issues. Hillary G, I already eat pretty well. I work out and have a trainer, but I'm insulin resistant. So insulin resistance doesn't actually cause any, doesn't prevent people from losing weight. In the studies and stuff like that, they took a group of people that had insulin resistance and a group of people that didn't, put them on the exact same calorie deficit diet, and both groups of people lost exactly the same amounts of weight. Actually, people with insulin resistance may have lost a tad bit more. So again, if you're not losing weight on this medication, you're not in a calorie deficit. So people always say, I eat pretty well. We need to look at, well, what does eating pretty well mean? Are you making all of your foods, all of your meals at home? Is your protein high enough level? So generally, I recommend your goal body weight and times that by 1, and that's how many grams of protein you should be eating in a day. Factor working out is awesome. That's fantastic. Having a trainer, even better. Are you eating plenty of veggies, getting plenty of fiber? You know, what's your other macronutrient ratios? Not quite as important as knowing what protein is. And also, what is your overall calorie intake? You know, are you consuming enough calories to properly nourish your body, to help build lean muscle tissue and that sort of thing, and maintain lean muscle tissue? So lots of other things that need to be kind of looked at and teased out. But fundamentally, if you're not losing weight on these medications or anything like that, you're not in a calorie deficit. So that's that, yeah. So Jen, super worried about increasing my Ozempic dose in fear of gallbladder issues. So the gallbladder issues, I mean, it's not every situation, but generally it's because of rapid weight loss. So if you're already on Ozempic and you're just kind of losing slow and steady or what have you, and you haven't had any gallbladder issues, probably very unlikely you're gonna get them by any means. Again, it's usually rapid weight loss because you get a huge amount of cholesterol entering the bile from the liver that travels to your gallbladder, gets stored, get enough cholesterol there, it then compacts together and creates gallstones. So that's going to kind of lead and cause that issue there. But yeah, in general, pretty low risk if you're taking it slow and steady. Hello, what is the best meal plan when taking Ozempic? Best meal plan is whichever one you can sustain for the long term. So there is no best diet, there is no best meal plan, there's no best way to eat or anything like that. It's whatever you can sustain for the rest of your life. Because whatever way you eat or find to eat, and it helps you to lose weight, you're essentially going to have to maintain and do that for the duration of forever. So Yeah. Lily D, Ozempic and eyesight. I think I answered that question. Barbie, is it safe to take Zofran with Ozempic? Yeah, in general, but check with your doctor and care team for your specific case. Wendy, instead of going from 0.5 to 1 milligram, can you go slower, such as 0.75? Yeah, I mean, you can certainly go slow. I have some people who, they're at 0.25 and then they do that for 4 weeks and they still get some side effects. We might go 0.25 plus 2 clicks and then 0.25 plus 4 clicks. So if you've got the adjustable Ozempic pens, you can adjust the dose and kind of go up as quickly or as slowly as you'd like. That's why I like the Ozempic pens versus the new Wegovy pens. Yeah, just kind of makes it easier in that sense. Mimi, where is the best place on your body to give Ozempic to get the best results? The abdomen and the upper thighs are kind of the areas that we've studied, and we know the absorption of the drug and that sort of thing. So that pretty much either of those are going to be good. There is no like best spot to inject or anything to get better results. The results are going to come from the fact of whether you're in a calorie deficit or not. Kind of belaboring that point, and that's just the reality. My TBR pile will be my demise on YouTube. What are the most recent findings on Ozempic and any risks for pancreatic cancer? So based on all the literature and meta-analysis that I've read and reviewed, like I said, you can go watch the start of the video where I kind of reviewed all this in detail, but pancreatic cancer, I would argue, is not a risk with Ozempic. Pancreatitis, maybe, but generally confounders, but pancreatic cancer, not a problemo. Tina, I was 315.58 and now I'm 252. Awesome. Mr. Wild Goose 1935. Is it normal to gain back weight one loses on Mounjaro or GLP-1? Yeah, as I kind of already said, 95% of people are going to gain their weight that they lost back when they come off of these medications. For most people, it's a lifelong medication that they need to be on to help manage their weight. Very, very rarely I've seen some people be able to come off the medications, but that requires a full lifestyle flip, if you will. So, again, eating whole foods, unprocessed foods, making your food at home, high protein, not overly restrictive and like cutting out cookies entirely from your diet and kind of being more mindful with your eating. Sleep, stress, gym, resistance training, starting to build muscle, all those sorts of things all need to be done and put into place and then consistently done in order to keep the weight off. So yeah. Thomas on YouTube. I've lost 92 pounds so far on Wegovy. I have 0 symptoms and feel great. Awesome. Glad to hear it. Shelly, is Saxenda and Ozempic the same thing? No. So this is Ozempic in this pen right here. It's a once weekly GLP-1 medication, and this is Saxenda. It is also a GLP-1 medication, so has the GLP-1 hormone in it. This one's once daily and less potent. This one is more potent, but it's once weekly injecting as well. So no, they're not the same thing. Regen, what is a therapeutic dose of Ozempic for weight loss? So Ozempic has semaglutide. Semaglutide is found in Wegovy. Wegovy, generally we push people up to a dose of 2.4 milligrams once per week for weight management. For Ozempic, we use anywhere from 0.25 to 2 milligrams once a week for diabetes management. Rosie, what about a combination of Ozempic and Xenical? I mean, maybe Ozempic certainly would maybe counteract the diarrhea and anal leakage that comes with Zenical. Generally, I don't put anybody, or I've only had one prescription for Zenical I've written. I didn't really want to, but yeah, it could be in theoretically used together, but I certainly wouldn't recommend it, and I would definitely not put anybody, at least not anybody that I like, on Zenical just because of the side effects. So yeah, good questions. Stacks, LMFAO, must have said something funny. Jen, I'm Banana Republic. Audience is thinner than your hair. No, that's not bad. It's an okay joke. I don't know why people are so obsessed with hitting the hair. It's always, I know it, I accept it. So thanks, I think, maybe, I don't know. Stacks, what's your salary? I don't actually even know. I just own multiple businesses and basically make enough money to get by. Right now, I'm broke as a joke because I'm opening up a new business. Yeah, I couldn't even tell you. I'll find out probably what I made last year pretty quick here with taxes and stuff. But yeah, it's a good question. Jen, I'm in Canada. We can't get Wegovy yet, so going to bump my Ozempic dose up. Yeah, that's certainly something that you can do. Yeah. BR, not a good joke. Your hair is great. Well, thank you, Wendy. I appreciate it. Even a tiny risk of anything with pancreas scares me. So, it's as with anything in life, there's always going to be potential risks and stuff. And you really have to look at, what is your own personal value set? What is ultimately going to work for you? And certainly when it comes to your own health, you've got to be your number one advocate. And, I could sit here all day long and explain the risks and show you graphs and charts and say, it's not that much of a risk or what have you and stuff like that. But ultimately, it's got to be up to you and your choice in picking what is going to work for you and how you're going to best take care of yourself, and whatever that is, that's your choice. There's absolutely nothing wrong with that, right? It's you and your health. And so, all you can do is get as informed as you possibly can, ask all the questions that you need to ask. And if there's something that isn't jiving or whatever, and you can kind of make your decisions and choices around that. It's the beauty of autonomy and agency when it comes to your own health and healthcare and living where we do, in particular in North America. So you have that opportunity and stuff like that. So just doing what you can to collect your own data and information and finding the people and stuff that you, finding people that you can trust and stuff. So. Den just started compounded Ozempic, surprised it worked great. What is your opinion on it? So the compounded ones, they're not exactly Ozempic, Saxenda, or Mounjaro. They're a different salt that's contained within them. So we don't exactly know how exactly the differences are. They're also research grade chemicals. So what that means is that they're designed for research, for injecting into mice and rabbits and that sort of thing, not designed to be injected into humans. So they don't get the same level of rigor and testing and stuff like that. Further, they're being mass compounded at present. Anytime you start mass compounding, and you put more of a human individual that's drawing things up versus having things done more in a robotic sense, a lot greater chance of potential error and potential pathogens and stuff getting introduced. There's good examples, especially out of the States, of compounding labs where various fungi and other things kind of got into the mixtures of certain drugs, and a lot of people have ended up dying because it takes a while to catch on to it and stuff. So me personally, I would not risk it at all. I know it's cheaper. And that sort of thing. Go for it, but I had the choice of something that we don't know and losing weight, I mean, I personally wouldn't risk it on myself. But yeah, whatever, you do you. And unfortunately, I know those clinics are also having people sign massive amounts of paperwork that ultimately removes them from any liability. So if anything does come up in the future, going to have a real hard time suing them. So really depends on yeah, what you're willing to risk, but I definitely don't recommend it. And it's yeah, I guess kind of your choice. So if you have no other issues and overweight only, a reason to be prescribed Ozempic. So if you have no other issues and you're just struggling with your weight, can you get prescribed Ozempic? Technically, yes, it would be off-label prescribing. So Ozempic only has the indication for diabetes. Sorry, I'm getting tired. Only has indication for diabetes. Semaglutide is also found in Wegovy, whereas Wegovy is a different pen, different dosages, but it has the indication for obesity. So both you could be prescribed. If you are prescribed Ozempic for weight loss, it's considered off-label. Doctor can do that, no problem. I've prescribed it off-label here in Canada, no problems, no issues. However, the issue you're going to bump into is when it comes to insurance and coverage. So if you're using Ozempic and you don't have diabetes, insurance won't cover you. Similarly, if you were prescribed Wegovy for diabetes, insurance won't cover you. They'll only cover it for obesity. So yeah, you technically could be prescribed it, but you may have to pay out of pocket. So hopefully that helps. DWA Consulting, what are your thoughts about using a GLP with something like phentermine or ephedrine caffeine type weight loss product? So using a GLP-1 with phentermine, yeah, I mean, in theory, again, it's something you could take together. As I was kind of talking about before stacking on other medications and stuff like that, always looking at what we've, dialed everything else in, just because if you're not able to achieve a calorie deficit yet, adding on another medication might not help that and might not do anything. So just making sure that, maybe we need a bit more appetite control, or there's a good reason to add the medication on. In terms of ephedrine / caffeine type weight loss products. So ephedrine, I definitely don't recommend. Lots of data has come out showing that it causes all kinds of cardiac issues, things like heart attacks, strokes. Basically, it's just not a good drug, and used in only very modest amounts because it can be potentially harmful to the heart. I took ephedrine back in the day in my more extreme, ridiculous, dumb bodybuilding days and stuff like that. So yeah, I know it doesn't really work that well for weight loss, I would say, but it's like super hyper caffeine kind of thing. But yeah, it caused me palpitations, increased my blood pressure. And yeah, so in general, I definitely don't recommend it, just because there is too much risk of harm. Caffeine has some evidence to show that it can help with like thermogenesis, so how many calories your body burns and stuff like that. So it certainly could be something that you take if you're drinking like a cup of coffee or two during the day. Well, you're already going to get that effect, and I really wouldn't go above that. I think max dose in a day is like 400 milligrams for women and like 600 milligrams for men. Don't quote me on that. I'd have to look that up to double check, but that would be kind of the max dosages that I would look at using caffeine for. And then also look at when you're using the caffeine and how you're using it. If you're using it in pre-workout before you go to the gym or something like that at like 6 p.m., definitely wouldn't recommend it, because then your sleep's going to be all screwed up, and sleep is much, much more important than what little benefit caffeine might offer. So yeah, hope that helps. Mimi's, my insurance denied Ozempic. I'm wondering if I have a chance for any of these other shots. It really depends on your it depends on your insurance, what they'll cover, what they won't cover. All you can do is ask and try. Then, thanks, makes me follow better. LOL. All right. User definition of professionalism right there. Thank you. I appreciate it. LV'd. Hello, hello, hello. Nicki Minaj. When am I tossing your spicy salad? It's the oddest pickup line I've ever heard, but yeah, I might use that on my girlfriend later. Samantha, can Saxenda cause low blood pressure? Not necessarily. I mean, depending on how much weight you lose, the loss of weight or fat mass could lead to a lower blood pressure. But in general, it shouldn't cause low blood pressure. Like mechanistically, it shouldn't cause low blood pressure. If you're not eating enough, or if your blood sugars are dropping too low or something like that, maybe. But yeah, shouldn't cause it. Thomas, thank you, Dr. Dan. Your Ozempic and Saxenda videos most likely saved my life. When I saw them last year, I had not lost 92 pounds of fat. I would have probably died. Wow, that is pretty. Wow, it's wild. I'm very happy to hear it. I'm glad it helped. So cool. Catherine, what are your thoughts on gallbladder and Ozempic? Catherine, I've already answered that one a couple of times tonight, and because we're kind of getting the end here. Basically, if you lose weight rapidly, yeah, can cause issues like gallstones and stuff like that. But in general, if you lose weight steadily, shouldn't be a problem. If you don't have a gallbladder, not a problem, not an issue. But if you want more detail, check out the start of my live, which will be posted on the YouTube here. So, Samantha, Mimi's, if it's possibility and affordable, you can get Ozempic and Saxenda over the counter. Boom, yes, you can. Samantha, okay, thanks. And Trisha girl on Ozempic 1 year, cholesterol went from 8.7 to 4. Yeah, so there's pretty good evidence actually that the GLP-1 medications without weight loss alone can also potentially bring down cholesterol levels and stuff like that. So yeah, like they can be quite effective, and maybe because it helps with dietary changes and that sort of thing. And reducing saturated fat intake. So yeah, lots and lots and lots and lots and lots of different things and mechanisms and whatnot. But I am going to leave it there, you beautiful people, because it's 8:45 here, and my 9 p.m. bedtime is coming up very quickly, and I still have one more meal / snack to eat before I go to bed. So yeah, thanks for tuning in, everybody. Check me out on my other channels at the official Dr. Dan. If you want to work with me, check out my website, healthyvolve.co. As well, if you want more details and stuff like that, check out my YouTube channels, or my YouTube channel at the official Dr. Dan. Lots of great detail on there. And yeah, again, thanks a lot, everybody. Have yourself a wonderful night.